He is also a prolific author. You may have seen his books, Engage, Transforming Healthcare Through Digital Patient Engagement, and eHealth, Telemedicine, Connected Health, the Next Wave of Medicine. Thanks.
Thank you, Dr. Tuckson. It's a real pleasure to be here, and I think like you, I've been learning a tremendous amount today and look forward to learning more from all of you, both on and off the stage. So I'm going to talk a little bit about vitaphone, our experiences past and present, but I'd like to lead this with a question. For the last 2 years, I've led this task force for HIMSS called Patient-Generated Health Data. We tried to get them to call it Consumer-Generated Health Data, but it was HIMSS and their providers, and they want to call them patients. So the question is this: how do providers who are already busy, and now they're getting more patients because there are more insured on the rolls with the Affordable Care Act, and these patients have more chronic diseases, how do they implement and scale telehealth? And I believe that the answer is in the Telemedicine Service Center. This is something that we've implemented in Germany. We've done it in the US for the past 5 years. A Telemedicine Service Center, we call it a TSC. It's helped to scale thousands and leaves providers to really do what they do best. So vitaphone, we started in 1999 in Germany, and really our focus is to apply mobile technologies to helping people help people. We help providers to take better care of their patients. And people say, well, how do you do that? We create a feedback loop from the patient to her provider with a high-tech, high-touch center, and that's both devices, hubs and software, questionnaires, and a clinical call center. This is a little snippet of some of the devices and other things that we've developed as well, in addition to having the telemedicine service centers. You see in the upper left-hand corner, this is called the Hertz, or Heart in German, Handy. Handy meaning mobile phone. We also helped to transmit the first EKG over the 3G network back in 2004. The lower right-hand corner, there's a little device with a yellow center. That's a medication adherence device called Pico. We're bringing a new version of this to the US market next year. I'm really excited about that. In the lower left-hand corner, you see our post-event recorder. It's the 100 BT and the 300 BT, which has been integrated with the 2Net platform. A patient can really take this out of her purse, place it on her chest, press a button, Bluetooth to the hub or Bluetooth to another gateway, and on to someone who needs to see that EKG, either symptomatic EKGs or scheduled EKGs. We also have developed software and continue to work in that space with the Life database. Now here is where we've seen telemedicine scale to thousands of patients, and we've truly seen the value of the Telemedicine Service Center. These are projects that we've done over the past many years. As you can see on the left-hand side, these are two major projects for managing heart failure in Germany. The patient size in the Core Bean project, if you look down at the bottom, was 2,928. Telemedicine for the heart, 1,100. This led us really to say we need to have a telemedicine service center. You can't expect that a provider is now going to be managing all the data coming in from devices. That's heart failure. We've also done in the two upper projects on the right-hand corner are hypertension projects that we've done in the US that I'll speak more to, as well as COPD. And then the Emotional program, which is in the lower right-hand corner, the AAL stands for Ambient Assisted Living, which in the US we call Aging in Place. And this is a program to monitor patients, rural elderly patients in their homes, and see how long can we help them stay independent before they actually have to go to a facility. Now, as I mentioned, the telemedicine service centers use devices, hubs, and software. We have our own solutions that we've utilized for many years outside the US. In the US, though, we have chosen very happily to work with Qualcomm, the 2Net platform, and then what you see there, it says helping people help people, Vita Health Services, that's our private label of the Healthy Circles patient management platform that Carolyn spoke of, and I know Dr. Malt, the founder, is here as well. And we've been working very closely with Qualcomm for the past many months to customize that for the workflow. So for those of you who are wanting to utilize Healthy Circles, but you need a telemedicine service center that is very familiar with it, that is us. Here's a little picture, or several pictures of our telemedicine service centers, both in Germany and in the United States. You can see over on the right-hand side, Scott Anderson, who's our nurse executive that manages our telemedicine service center, and Scott's out here somewhere. I encourage you to talk with Scott. Christine Caswell is also our supervisor who's sitting next to him for chronic disease management. So if you want to hear more from some clinical experts, how does this telemedicine service center work and what exactly do you do? I welcome and they welcome your conversations. Now, if you get nothing else from my presentation today, I want you to remember this slide. This slide shows scaling telemedicine. This comes from a project. It's a peer-reviewed article published. It's called the DETECT project. It was published in the Telemedicine and eHealth Journal. Program that we did with Biotronic around their implantable cardioverter defibrillators, their ICDs. And essentially, the idea was most of these devices typically transmit directly into the provider, and they're having to work with all of that data. What if you put a telemedicine service center in the middle? What did the providers think about that, and what did the patients think about that? Well, first, let's look at the data here. You can see the number of alerts received, 2,037. Our telemedicine service center then triaged and filtered these alerts, only to result in 20 messages that were actually forwarded to the patient. Can you imagine if all of that data was coming in directly to the provider? And it's analogous to exactly what we do. One of our business lines is cardiac event monitoring and mobile cardiovascular telemetry. We have a 24/7 monitoring of EKGs that goes on because providers can't be monitoring patients 24/7 and watching all of those EKGs. So again, the value of the telemedicine service center. Now, that last study that I mentioned here, this one, there was one other outcome that came from this. They asked the providers and the patients, do you think that this provided the same level of care or better care? And 65% of patients and providers said using a telemedicine service center in the middle actually provided better outcomes, better care. And speaking of outcomes, this shows the outcomes of our hypertension pilot that we did right here in the United States, about 100 miles north of here. 30 patients for 37 days. And again, using that feedback loop of providing twice a day blood pressure monitor into our telemedicine service center, comparing it, doing the exception-based alerting that Carolyn referred to earlier, to the protocols that we were provided by the providers, and then engaging the providers when they needed to. It's 190 systolic, and the patient, has blurred vision. The next step, the provider then engages. They might then change the medications, and that's really what we saw occur here. In those 37 days, the providers didn't bring these patients into the emergency room, didn't bring the patients into even the ambulatory clinic, into their office. They engaged them over the phone, changed their medications. The patient went to the pharmacy, picked up a new medication, and guess what? That care path that typically takes 6 months or a year to get a newly diagnosed hypertensive patient controlled happened in 37 days. You see the systolics in that time dropped from 155 to 125, and the diastolic, which is even more significant, dropped about 9 points. Now, we've talked about scaling telehealth. We've talked about outcomes. Now I'd like to talk about the patient-centeredness and the patient experience. So it's one thing to have great outcomes, and a short-term outcome or an immediate outcome is wonderful. But what do we all want? We want activated patients who are going to take an active role in changing those 70% of things that actually can impact their chronic disease. So we found in our hypertension pilot, for example, we developed educational programs. Since we're going to reach out and ask a questionnaire to them every week anyway, let's follow that questionnaire with an educational module. First week, let's talk about hypertension in general. Second week, let's talk about your medications, et cetera, et cetera. We had 4 modules that we put these patients through. And you can see on a scale of 1 to 5, 4.41, I learned new information that will be helpful in managing my hypertension. 4.45, I better understand my hypertension risk and key management principles that will help me to better manage my condition. Boy, isn't that what we want? I know that the CDC has said if you spend just $1 on educating a diabetic patient, you're going to save $8 in care. We need to take advantage of these opportunities to further engage these patients. Now, what conditions are we currently monitoring or have the capability to monitor? We've developed specific programs around, again, the EKG monitoring, heart rhythm disorders, CHF, hypertension, COPD, diabetes, PTINR. We're working in Germany with that, and we're working to bring that into the United States. And then the last one, hip and knee replacement. So many of you may know hip and knee replacement readmission penalties are now on the radar screens of hospitals. But as Scott had referred to me the other day, there's actually a new code coming out in January that's going to incent the ambulatory providers to work with the hospitals where these patients are discharged to keep them out of the hospital. So we've developed a program for that if anyone's looking for that. But I say this, these are programs that because of the strong need, I mean, CHF has the highest cost readmissions. Why not work on that? If anyone out there is interested in developing more customized programs using the TUNET ecosystem and the devices, but using a clinical call center, we are very happy to engage you. You can see at the bottom a list of the devices alone that we have integrated into our system and are working with in our vitaHealth Services program. So what's next? It might be you working with vitaphone eHealth Solutions and utilizing these assets to help you achieve your goals. We are interested in talking with those who will benefit from our existing programs, especially a clinical call center or the telemedicine service center as we call it. Those who want to explore or build new programs. Partners where maybe market synergies exist. Maybe you've got a device set that you're saying, you know, we'd love for you to utilize this in rolling out your new CHF or COPD programs. And likewise, device and software firms that are committing also to this ecosystem. So I want to say, again, thank you for the opportunity to present today. Excited to learn from more of you.
Thanks, Brad.
Thank you.
Appreciate it.